Hi, I'm Dr. Halim Nalabed, the woman who personally experienced when the Viagra failed that morning. You are in the right place if you want to know what exactly is erectile dysfunction and how does it work or not work. Before we get started, to get the most from these videos, turn your phone off, close out any other windows, and get rid of any distractions to focus on the next few minutes into what we will talk about today. Before we start, you might want to grab a pen and a notebook because you will want to jot some notes down. If you have any questions, please don't be shy. Ask me any questions you may have, and I'll best get back to you ASAP. Or you may email them to me at info@malabedmethod.com. What I will talk about today in this video are the facts about erectile dysfunction. And by the end of the video, you will be clear about the facts regarding erectile dysfunction. So let's get started. Fact 1. ED or erectile dysfunction is normal. First, you need to understand that an occasional impotence episode is completely normal. At some point in a man's life, they will face this problem. ED is often defined as an inability to maintain or have an erection hard enough and long enough to have satisfying sex, or having brief erections and the inability to have consistent erections. It's when it becomes more of the norm than a fluke is when you want to start to worry. Suppose you've noticed that your erections in the morning aren't as hard as they used to be, or that you're having trouble becoming firm. If that's the case, this isn't just something to accept, because Houston, we got a problem. Erectile dysfunction can be avoided and treated with proper information. Fact 2. ED is not a taboo subject anymore. There was a time when no one talked about it. No one talked about impotence or ED. This is no longer the case. With more ED treatments, regular commercials, and advertisements for ED, it's just another condition that modern medicine has started to treat. You don't need to feel ashamed to talk to your partner or to your doctor about ED. By creating an open communication about erectile dysfunction and solving the problems that your ED is causing you will allow your personal relationships a chance to become stronger and better. You'll feel stronger, more confident, less anxious, and more self-assured as you take control. Fact 3. ED is not premature ejaculation. Do not become confused by the other sexual problems that are out there, like premature ejaculation, otherwise known as PE. True erectile dysfunction focuses solely on whether an erection can be maintained or not. A man with premature ejaculation can still have an erection. He simply has an orgasm too quickly for him and his partner to be satisfied. Well, this is an issue. This is not erectile dysfunction. Some people have premature ejaculation who also have trouble with erectile dysfunction, but it's generally not seen the other way around. One of the biggest mistakes is that when it takes to have an erection is one that doctors do not explain to their patients. Therefore, many men do not understand what often leads to misunderstandings and confusion about ED and how it happens. I'll be talking about that in one of the upcoming videos. Fact 4. ED happens because of blood flow issues. Here's what you need to know. In the penis, there are 2 chambers filled with spongy tissue. This tissue includes veins, arteries, smooth muscle, and other components and tissues. When a man is stimulated visually or emotionally, the brain tells these chamber muscles to relax, thus letting the penis fill with blood. This blood flow will also cause the penis to become erect. There is a chemical reaction that occurs, which also helps keep the blood in the chamber. During the orgasm, the muscles are contracted, allowing the blood flow to reverse and release the actual erection. The problem with ED is that certain things happen that disrupt the blood flow to the penis, causing the erection to be less firm or to be non-existent. This can be due to a physical issue, an emotional issue, or both. And we'll cover that later. Fact 5. What you might not realize yet is how many treatments and therapies are available right now. While we're all pretty familiar with those little blue pills, this is just one of the many different ways you can help your body achieve an erection. Each man should have a personalized treatment for their ED to guarantee success in having a satisfying sex life. A personalized treatment consists of lifestyle changes, supplements, relaxation, techniques, and maybe medications and surgery if needed. All of these are just a few of these that can work together to ensure your penis is ready for that right moment. Fact 6. ED is not your fault or anyone else's fault. You need to keep in mind that erectile dysfunction isn't your fault in any way, shape, or form. In the end, ED is treatable and manageable, but it is not a condition that responds to blame or ignoring it. Many factors play into your risk of ED. So stop blaming yourself and others for your erectile dysfunction and just focus on fixing it. It's what I do all day and every day. This is an issue that simply just happens from time to time. You aren't necessarily able to control it or stop it when you're unaware of how this situation occurs. As you are looking for help with erectile dysfunction, you want to keep in mind that this issue isn't hopeless. Even though you've probably begun to start thinking that there's nothing to be done, it's something that bears repeating. You can do something about it. In my next video, I'll go into the 3 myths that keep you soft. Right now, realize that you can change your sexual problems into sexual successes. If you'd like, click here to take the quiz now to find out your #1 morning erection killer.